Hi, this is Dr. Michael Barr, Senior Vice President for the Division of Medical Practice at the American College of Physicians. Welcome to ACP Practice Advisor and this short demo of the maintenance of certification functions within the Practice Advisor. From the home page, you can click on Modules and scroll down to the Maintenance of Certification category. Click View Modules. Currently, there are two modules within Practice Advisor that are eligible for maintenance of certification requirements for internists. We will be seeking recognition by other boards within the next few months. The concept behind the maintenance of certification modules is for a physician to focus on a particular clinical condition while the practice focuses on improving the practice's performance on the same clinical condition. For example, within the Improving Clinical Care modules, you'll see two modules related to immunize adults and managing diabetes mellitus. There are corresponding maintenance of certification programs within Practice Advisor. Let's take a look at the Manage Diabetes Mellitus MOC module. We'll click on Explore MOC and be taken to a landing page which explains how do I earn MOC credits, why this is important, and how the tools will help. From here, you can go to the original Improving Clinical Care module by clicking on Explore module, or you can take the Practice Biopsy, which is part of the original Diabetes Mellitus module. For the purposes of demonstration, we'll go straight to the survey, which is part of the MOC process. The MOC process requires physicians to do an abstract or chart review of 25 charts on a minimum of 3 measures. Then, institute a clinical performance improvement process based upon the findings of the chart review, and then 3 months later come back and do another chart review of 25 records. For the Diabetes Mellitus module, you'll see that there are 3 measures here. Has the patient had a dilated eye exam for diabetic retinal disease at least once within 12 months? Was urine protein screening performed, or is there documentation of treatment for nephropathy during at least one office visit within 12 months? Was a foot exam performed at least once within the last 12 months? As you complete each chart review, the system will advance to the next number. For the purposes of this demonstration, we've already completed 24 charts. Let me show you how to complete the 25th, and that will take us into the reporting features. We simply enter a month, day, year, and answer the questions. I'll just randomly pick a few answers, and then we'll go to the bottom and click Next. Once the 25th chart has been recorded, the system will provide a summary about performance on the 3 measures. For question 1, the overall response was 88%, which is the sum of 24%, 32%, 20%, and 12%. You'll note that the question is in green because that is a good performance. On question 2, we also did pretty well at 84%, and you can see the various percentages for each of the answers. And on question 3, our overall performance was 52%. Had the performance on these measures been below par, the question would be in red, indicating poor performance. In this case, since the lowest performance on the 3 questions was on foot exam evaluation, I'm going to go ahead and check foot exam as the measure that I would like to improve upon. Now I can save and review results. The results of your maintenance of certification efforts are summarized under My Account and My MOC Results. You can see on this page that Immunize Adults was done the last time on July 9th, 2013, and there were 2 survey completions that I've done, and 5 survey completions done by everybody else in the Practice Advisor community. Manage Diabetes Mellitus, at this point, mine is the only one in there, and nobody in the community has yet done a Diabetes Mellitus chart survey. To compare pre and post, it'd be better if we use the Immunize Adults, so I can show you what happens when you've done your second survey. Click on Immunize Adults, and you're taken to your summary page. Across the top are the measures. In this case, percentage of patients 65 years old or older who ever received a pneumococcal vaccine, percentage of patients under 65 years old with a high-risk condition who received a pneumococcal vaccine, and percentage of patients who received an influenza immunization or reported previous receipt of an influenza immunization during the appropriate flu season. You can see that in June I did my first survey, and I did 25% performance on the first question, 40% performance on the second, and did reasonably well on influenza. At that point, I selected 2 measures for improvement. Remember, you have to check at least one of the 3 for improvement during the 3-month period. In this case, I checked 2. When I redid my survey of 25 charts, there was an improvement from 25% to 38%, from 40% to 50%, and from 62% to 85%. Change since last survey is reflected over here. Total change over time is the same, since we're just reflecting the difference between the benchmark and one subsequent measurement. At the bottom is the community benchmark, based upon the 5 surveys that were done by the community. Now, if you scroll down, you can see a bar graph representing the benchmark data, which is an average across all measures. My measure in June, which is the average across all 3 measures, and my July average, which was 58%. Now, for purposes of maintenance of certification, you need to document what you did between the first time you did the chart surveys and the second time. And you'll do that by completing this text box, which will show up after you come back to do your second survey. And you'll see here that on this measure, percentage of patients 65 years old or older who ever received a pneumococcal vaccine, I originally had only 25%. What did I do? We created a registry of patients and queried it, then sent reminders to patients who were eligible and did not have the vaccine. We added posters to the examination rooms, and we created a standing order. If I click on the second measure, you can see a similar text box in which I just simply wrote, similar to the prior one, we did a registry, mailing, buttons, and signs. Of course, you will likely have more detail in your measure explanation, but for the purposes of demonstration, I kept it simple. You can print this page using the print icon at the upper right, and that can serve as documentation of your completion of this maintenance of certification module. Thank you very much for listening to ACP's Practice Advisor Maintenance of Certification Functions.